Hi, my name is Liliana Vasquez. Sorry, I'm losing my voice. Today I'll be talking about Tay-Sachs disease. It's a rare but serious inherited genetic disorder that affects the brain and spinal cord. I'll discuss what causes it, how it's inherited, its symptoms, treatment options, and why genetic testing is so important. What is Tay-Sachs disease? Tay-Sachs disease is a progressive neurological disorder that destroys the nerve cells in the brain and spinal cord. It's caused by a deficiency in an enzyme called hexosaminidase, or Hex-A for short. This enzyme's job is to break down a fatty substance called GM2 ganglioside. Without enough of this enzyme, GM2 builds up inside nerve cells, eventually causing them to malfunction and die. The buildup leads to severe symptoms seen in Tay-Sachs patients. I will talk about the inheritance pattern. Tay-Sachs disease follows an autosomal recessive inheritance pattern. That means a person must inherit 2 defective copies of the hexa gene, one from each parent, to actually have the disease. If someone only has one defective copy, they're called a carrier. Carriers don't show symptoms but can still pass the gene to their children. Now I will give you an example of a Punnett square when both parents are carriers. There's only a 25% chance that the child will come out completely normal. That's you'll see when you look at a Punnett square. That will be 2 capital T's. There's a 50% chance the child will be carrier like the parents, which is a capital T and a lowercase t. And there's going to be a 25% chance that the child will have Tay-Sachs disease, which is 2 lowercase t's. This simple genetic chart shows how one gene from each parent can drastically change and impact health outcomes. Now we're going to talk about symptoms and onset. Symptoms usually appear between 3 and 6 months of age. At first, babies seem to develop normally, but then they start to lose motor skills like rolling over or sitting or even crawling. As the disease progresses, more severe symptoms appear, including seizures, vision and hearing loss, intellectual disability, and eventually paralysis. One of the most recognized signs is a red cherry spot on the retina, which doctors can see during an eye exam. Sadly, most children with Tay-Sachs don't survive beyond early childhood. Now I'm going to talk about treatment and management. Currently, there is no cure for Tay-Sachs disease, which makes it even sadder. This treatment focuses on managing symptoms and maintaining comfort and quality of life. Common supportive measures include physical therapy to help with movement and muscle tone, respiratory care to prevent infections, nutritional support, and medications to control seizures. Families are also encouraged to work with genetic counselors to understand their risk and future reproductive options. So some daily life impacts. Living with Tay-Sachs has a profound impact on families. Because the disease is progressive, children require constant care and medical attention, and parents often face emotional and physical exhaustion. Support from healthcare professional counselors, community groups can make a huge difference. Emotional and social support networks are crucial for helping families cope with this. And some recommendations and research. So here are a few key recommendations to to prevent or manage Tay-Sachs, genetic testing and carrier screening, especially of Ashkenazi, Jewish, French Canadian, or Cajun descent, where carriers rates are higher. Early intervention and access to supportive therapies, and participation in clinical trials that explore new treatments. Scientists are actively researching enzyme replacement therapy and gene therapy as potential ways to correct or replace the faulty hexa gene in the future. And then this is where I'm leaving off. In conclusion, in summary, Tay-Sachs disease is a powerful example of how genetics can influence human health. Although the disease is devastating, genetic counseling, early detection, and research advancements offer hope to better prevention and care. Understanding conditions like Tay-Sachs help us appreciate the importance of genetics in medicine and the role each of us can play in supporting awareness and research. Thank you for listening. Bye.